Hello, TTT Mamas. Welcome back to our beautiful space. I actually want to talk about consistency. I just decided to talk about it, especially for my TTT mom, because somebody just came to our facility now and the person left. So the person came with, she's also trying to conceive. She came with series of complaints that she's tired of all the time drug, that she's tired of the prescription. And I asked her, how long have you taken the drugs without getting rid of it? She said, just 1 week, that is so tiring. Now, please, grace differs. I'm talking to my trying to conceive mothers. Grace differs. Someone can take for 1 week and get positive response. Some can take for 2 weeks and get a positive response. Some can take for 3 months, 6 months. Some can even take for 1 year before they get a positive response. Remember, your journey and another person's journey is not the same thing. Yes, if your doctor has prescribed a fertility medication, one of the most important things you can do is to take it exactly as directed and remain consistent. Many women becomes discouraged after a few weeks or a couple of cycles, but fertility treatment often requires patience and commitment. You get what I'm talking about? I said fertility treatment requires patience and a lot of commitment. Now, let me take you down why consistency is very, very important, because some of you don't know why this word consistency, if you're trying to conceive as a mother, why it is important. Why it is important is that, number one, your body needs time to respond. Yes, your body needs very good time to respond. Hormones and fertility medication work gradually. Your body may need several cycles before showing significant improvement. Your body might need like 1 month cycle, 2 month cycle, or 3 cycle. That was why I said several cycles before showing any significant improvement. Yes. Number two is that doctors monitor your progress over time. They'll keep monitoring. That is why even skipping your appointment, doctor's appointment, if it is not proper, is not good. So if a doctor said, come in 1 month time, and he placed your medication, it's expected you continue taking that medication until when you go. There might be need he change to another one or tell you continue. But some of you don't even come after that 1 month. And some of you, after that, once you get to that 1 month, you have changed. You've heard a friend say, this one did, this one worked for this one, and you're already switching to that one. In fact, you just took your own for 1 month, 1 week or 2 weeks. You've abandoned it. You've gone to take another one for like another day. How will you get a response? You will not get response. So you see what I'm talking about. Then regular use of medication allows your doctor to evaluate how your body is responding. I say that, and make necessary adjustment. If you're able to maintain that medication for like when you go, your doctor will see your body, see the response your body have given, and the doctor will know, am I going to continue taking this? Am I going to continue this with her, or am I going to make adjustment, or am I going to add more? So this is what it entails. Now let's talk about number 3, why that consistency is important. Skipping doses of your medication can affect your result. Now you're asked to take the dosage morning and night, 1 tablet morning, 1 tablet night. And you see some person only taking the morning without taking in the night. In fact, the next day they don't even take. After 3 days, they come back to come and take the medication and start taking it in. You're not taking the dosage as prescribed, which will affect the resultant effect of it. Missing medication or taking them inconsistently can interfere with your hormone balance. Very correct. And reduce the effectiveness of that treatment. I don't know why. You don't just listen. You don't take your medication serious. When you come, you start lamenting, I've done everything. Then the person that walked out, that came here and just left, do you know what I asked her? I asked her, okay, now you're complaining. You were asked to take for 1 month. Have you taken the medication straight for 1 month? She said, to tell me the truth, no, that she will not lie again. That was what she said. I said, you see, you've not taken medication that was prescribed for you for 3 months, for like 1 month. I said, okay, the 2 weeks you said you took, did you take morning and night as well? She said, no, that's sometimes it was in the morning. In fact, that she got tired. I said, got tired over 1 week. Then how do you even want that cycle to return back? So that is just the thing. Impatient is our problem. Now, every woman, I want you to know one thing, every woman responds differently. Some women conceive quickly, even after 1 month medication, while others need several months before seeing positive results. I've managed a woman that, okay, she has tried so many things, not as if she wasn't taking medication those period, but when she came in contact with me and I was able to counsel her, manage her for 3 months, after 8 years of trial, and this woman conceived. God helped us. God came in through for her. You see, that is her grace. Then I've also managed somebody that took in after 1 month. Do you understand? That is her grace. God came in for her. And I still managed a woman about 46 years old that's conceived after 1 year too. That is her own. So what did I say? One person was like 3 months after several years of trial. Then one person was 1 month. There's another one too that was about 6 months. So, and it still worked for her. So everybody have their pace. So remember, your own journey and another person's journey is different. So why should you, why will you start rushing? Why will you start complaining? Why they rush? Why they complain? Many fertility treatments are assessed over several months. In many cases, doctors may recommend continual treatment for around 6 months before evaluating the overall effectiveness. Seriously, many is 6 months. Continually 6 months, stretch 6 months. 6 months. But many persons, after 2 weeks, they are complaining. After 1 month, I know this journey is not easy. I've been there. If to tell you the truth, it is not easy. Why I'm saying it's not easy, because I've been there before. That is why I can beat my chest. I can say it is not easy. Yeah, it's not easy to be a titty mom, to be trying to get pregnant. But it's not easy. Most times when you see another baby by the side, another woman you just be wishing, I wish this was my baby. Yes, it's not easy, but definitely you will get there. So that is why I'm actually making this video, to tell you that consistency is very, very important. Although the exact timeline depends on the medication and the individual situation. Instead of focusing only on the outcome, focus on taking your medication correctly. Do you understand? Attending follow-up appointments, very, very important. Tracking your cycle and ovulation. Maintaining a healthy lifestyle. So if you're trying to conceive, leave junk food, eat healthy food, very healthy food, very, very important. What happened to instead of always feeding on snacks and whatever, what happened to avocado pear? What happened to cucumber? What happened to watermelon, carrots, nuts and all that? What happened to it? What happened to berries? So what happened to those? Eat healthy food. This can actually help. Do you understand me? So I want to tell you, remember, the TTT journey is not a race. You are not in competition with anybody. Stay consistently, trust the process, and keep communicating with your healthcare provider. Every step you take is bringing you closer to your goal. Okay, now, why wouldn't you be grateful? Your message was not regular. Sometimes you stay 4 months without seeing your message. So you started your medication and messages start coming and you are not grateful. Ovulation start correcting small and you're not grateful. You just want to get pregnant. No. It doesn't work that way. Please, I want to tell you something. Don't give up, but I want you to be consistent. Keep going, keep pushing, keep believing, and don't forget to pray to God. He is the only final solution, no matter how hard we try, but God supersedes everything. Thank you so much for listening. I hope I have spoken to somebody that feels all hope is lost. Please, I want you to know that all hope is not lost. You are almost there. Thank you so much for watching, and please subscribe to my channel. Thank you. Bye-bye.